good morning. So I'm gonna perform a tracheostomy care. So first things first is check the patient's chart, make sure we obtain any relevant information, and then any complications the patient was having or check if what appropriate size the tracheostomy of the patient is. So once inside the room, make sure we wash our hands, introduce ourselves, and explain to them by telling them that good morning, my name is Anthony, a respiratory care student from the respiratory department. So I'm here to clean your tracheostomy and replace with a new and clean one. So before that, make sure we check the ID band of the patient to know if they're the exact and correct patient, and then we proceed in wearing appropriate PPE such as gloves first, and then we have to always do our assessment by listening to the breath sounds and obtaining any vital signs such as the SpO2 and heart rate. So once everything is done, make sure we have the necessary supplies present, such as if this is the trach kit, we also have the hydrogen peroxide if we have right now, and then a sterile water. So with that, we also have at least more than one cotton applicator, and then we have the sterile water poured on the side and then on the other side is the hydrogen peroxide. So after that, make sure we also have a appropriate sizes of tracheostomy just in case. And then first is we have to suction the patient, make sure we clear out their secretions, and then with the inner cannula, for assuming if this patient has a tracheostomy of a non-disposable one, we have to carefully twist it on the side because it's been locked, and then try to unlock it by carefully removing it. So with that, when cleaning this one is we have to clean it with a brush with the hydrogen peroxide. Once you're done cleaning it with the hydrogen peroxide, we have to clean it up or sterilize with the sterile water and allow it to air dry. And then once you're done suctioning, make sure we have to check also the size itself of the tracheostomy, if it is appropriate of what we are bringing along with. And then make sure we also have another clean set of a tie if we're using the traditional way of tracheostomy. But nowadays we do the new one, such as the Velcro. And then after we did those, we have a cotton applicator with the hydrogen peroxide. So when we clean the stoma, if it's being removed with the inner cannula, if assuming this is the stoma, make sure we clean it on a circular motion. We should not push it gently, the cotton applicator, towards the tracheostomy itself, because it might cause any trauma or bleeding. And then by the way, with the suctioning also, with the suction catheter, we should not also push it too deeply, because it might cause the patient to cough it even more with their gag reflex. And then once you clean the stoma itself, we should always dispose it, and then we should also have another cotton applicator, and then we should also clean it on the sides with the exterior portion. So with the exterior portion, especially if this is the stoma, we have to insert it in between underneath, then not push it gently because it might insert it directly to the stoma itself. And then we have to remove the 4x4 gauze, especially if it's being soiled. And then we have here another clean gauze, of course, so we should always replace it with a new one, so it will be inserted here in between with the tracheostomy in the middle. And then another thing is with the tracheostomy tie, if we use the traditional way, we have to cut it carefully, but when cutting it, make sure we set aside the pilot balloon to prevent accidents of pilot balloon being accidentally been cut. And then if we retie it with a new one, make sure we hold it, the neck plate itself, and then we insert it on the side and make it like a loop on the other side and tie it carefully. And then we can also measure it if it's too loose or too tight with our two fingers, inserting in between, and then we can readjust it. And then once everything is done, make sure all the supplies that we used, such as the tracheostomy care kit and even the gloves and PPE, should be disposed in the disposable basin. And then With the non-disposable tracheostomy tube, when removing the inner cannula, we should also have another permanent inner cannula to put to the patient before we put it up with a new clean inner cannula. And then once you're done everything, make sure we do our self-compose assessment, listen to the patient's breath sounds, observe also the vital signs, and then once you're about to go outside,